Hello and welcome to O'Neill Marketing's July 2023 ACA Roundup webinar. Really appreciate everybody coming out and joining us again this month while we give you industry updates and other news. Without any further ado, let's go ahead and get started. Right, and as always, just want to give a brief overview of the webinar structure, doing monthly webinars that cover industry news updates and any other important news that the O'Neill marketing team wants you to know about. Webinar slides will be sent out to everybody after the webinar, and then we'll also upload a copy of the slides as well as a recording to the agent portal afterwards. So be sure to check the agent portal later on if you need to view this webinar or look at a recording. If you have any questions during the webinar, go ahead and put them at the Q&A area on the left side of your screen. Probably not going to be able to get to questions live today, but if you submit over there, we will answer them via email and then make anything important that we want agents to know about available to everybody, again, through the agent portal. So let's go ahead and get started with just some industry news for you. So we want to start out this month as well, mentioning the Friday Health Plan withdrawals. So Friday Health Plan, we mentioned a few last month. They are withdrawing from more states. Currently, it's Georgia, Oklahoma, North Carolina, and Colorado. So consumers that are currently enrolled in Friday plans are right now eligible for an SEP to sign up for a new plan. They should have already been notified, but it's really important that you guys know as well, so we can encourage them to do so. So the current Friday customers in those states will need to choose a new plan during their special enrollment period. The special enrollment period does go beyond when their plans end, but if they want to make sure they don't have any gaps in coverage, they'll need to make sure that they're utilizing that before their plan ends so that they can start a new plan the next day. Friday customers should have already received notices that their plan is ending, both from Friday and CMS. But just as you know, sometimes those can go missing. So it's important that agents as well are going back and notifying all your clients, again, Friday clients in Georgia, Oklahoma, North Carolina, or Colorado, about the fact that their plan is ending and encouraging them to start looking for a new one. And any existing customers will have their claims paid and they can continue to use their insurance until the plan's end date. That does vary by state, but we have some charts here on the next slide for you. And so as you can see here, Georgia plans for Friday are going to be ending on July 31st. So only a few days left for clients to go ahead and get that in. Again, right now it is the 25th. So there's only a few days left for them to use that SEP if they don't want to have any breaks in their plan. As you can see in the column on the right-hand side, the SEP does last about a month beyond the plan end date. Or 2 months rather. So they have until the end of September to choose a new plan. But as you know, if they don't choose a new plan by the end of July, they are going to be without coverage for at least a month. So especially in Georgia, with plans ending on July 31st, want to make sure that you're letting your clients know about that and that they have plans to go ahead and get enrolled in a new one. And then Oklahoma, North Carolina, and Colorado, those plans are going to be ending on the 31st of August. So clients have a little bit more time, but come August, they are going to want to start looking for new plans. And as your agent, you'll want to get in touch with them to let them know about it and help them start shopping around so that they can be set up and enrolled in a new plan by the end of August and have that plan start on September 1st. And just generally, a recap of what we want to do about this. First and foremost, definitely make sure that your clients are aware of these withdrawals and make plans with them to enroll in a new plan. If they're in Georgia, make sure they're doing it by the end of July. All the other states, make sure they're doing it by the end of August. Again, the SEPs go a little bit longer, but if they want to avoid any coverages in their health plans, they'll want to make sure they are set up sooner rather than later. And definitely encourage clients to be proactive about the plan changes just to make sure they don't have a coverage gap. One of those things, it's very easy to procrastinate and let it go by, but they will be happy if they don't have any gaps in coverage. And then other than that, would definitely recommend you familiarize yourselves with other plans that are available in Georgia, Oklahoma, North Carolina, and Colorado. Familiarize yourself with the other carriers available there and make sure to go ahead and get any necessary appointments. We have a slide on the next one with a link to our products map so that you can see which carriers O'Neill Marketing is offering. And then last, as we said last month, Just make sure you're receiving the update emails from Friday and from CMS. Those are typically going to be the first places that you'll hear about these, so it's important that you're getting those emails. And these are just the resources for you. We have the SEP notices and other information for all 4 states. And then at the bottom there, we have a product map for O'Neill Marketing so that you can click on any state and see which carriers O'Neill Marketing is offered there. Again, if you're not appointed with some of the other ones, now's a good time to go ahead and make sure you have all those appointments. We also wanted to mention the CMS Marketplace Learning Management System closure. So the MLMS for CMS went dark on July 14th at 9 a.m. That's in preparation for the release of the plan year 2024 FFM certification trainings. So right now, agents cannot get FFM certified, and they won't be able to until that system reopens. So I know that's been a question we've gotten. If you're not already certified, you will have to wait just a little while. Typically, they reopen in early to mid-August. They didn't give us a hard date. We will, of course, let you know if we get more information, but just generally would say keep a lookout and know once that reopens in August, that's a good time to go ahead and get certified. Or if you're already certified, go ahead and get recertified. It's pretty quick and easy. Doesn't take that long, so we recommend, as with most things, be proactive about it and don't wait too long. We will notify everyone when the trainings are released. So, if you are unsure, don't worry about it. We'll definitely let you know, but I would expect early to mid-August. Also wanted to mention as well that it's been indicated that upon completion of the 2024 FFM certification, we're expecting that agents are going to be able to write plan year 2023 policies even if they weren't previously certified. So that means that if you did not get your 2023 certification and you've missed the cutoff for the 2023, you should be able to, in mid-August when the 2024 certification reopens, to take that certification, and then you'll definitely be able to go ahead and start your contracting. You won't have to wait until plan year 2024. But we are also expecting that you'll be able to write 2023 plans as long as you have the 2024 certification. So let's say you have a client that needs a September or October 1st effective plan. As long as you have the 2024 cert, you should still be able to write that. We will be releasing more information as it comes out, though. Also got a lot of questions about this, so we wanted to talk about the Georgia state-based exchange with everybody. So if you haven't already seen, Georgia will be launching its own state-based exchange called the Georgia Access for the 2024 open enrollment. So Georgia is currently maintaining the same requirements as healthcare.gov currently has, but with the addition of the Georgia Access certification training, just an additional state-based exchange certification that you'll need to get if you plan on selling in Georgia. So Georgia has already sent out emails with certification information and links to all Georgia licensed agents. If you don't know if you've gotten that email, definitely recommend you go back and double check. They should have sent it out to all the Georgia agents, and it does have a lot of good information in there. So if you are licensed in Georgia, you haven't received that email, maybe double check what email they have on file and make sure that that email gets to you. So the certification itself is going to need to be completed by September 18th. Agents are going to need to activate after their certification their Georgia Access Agent Portal between October 20th and November 1st. So kind of a small window. So that's just the important thing to remember. You'll have to do the certification training in the not too distant future, finish that by September 18th. And then after you've done that, you'll just need to check back in October 20th to November 1st to activate your Georgia Access Agent Portal. That's really important because they have said that agents who do not complete certification training and activate their Georgia Access Agent Portal within that time frame are not going to be assigned their current consumers when consumers are auto re-enrolled before open enrollment 2024. So pretty much that's just to say that as with Health Sherpa or other ones, your clients will roll over their AOR if they re-enroll or automatically re-enroll. But if you do not do your Georgia certification and activate your Georgia Access Agent Portal, those consumers will not be assigned to you. So even if you don't plan on really doing a lot of marketing or actively going to anything in Georgia, if you still have existing clients in Georgia that you want to keep, I would still recommend to get this certification and activate your Georgia Access Agent Portal account so that those clients can roll over for the new year and you can at least still be the agent of record for them. Also wanted to mention the EDE service as well, because Georgia has indicated that agents will be able to enroll Georgia clients through certified web broker platforms via an enhanced direct enrollment. Now, EDE, enhanced direct enrollment, that's the same thing that on Health Sherpa lets you do applications to healthcare.gov without actually having to use the platform. So it's what everyone has to do on Health Sherpa so that they can do the entire application and enrollment process without going to healthcare.gov. So Georgia's indicated they will be doing a similar thing, and this will very likely include Health Sherpa. So hopefully, once we get more information, it will be the case that even though Georgia is a state-based exchange, as long as you're certified and have done all the other processes, that you will be able to enroll clients still in Health Sherpa. Either way, agents still are going to be required to follow the certification steps that we outlined in the last slide. So even if you're planning on just using Health Sherpa for Georgia business, got to make sure that you get that certification and have that Georgia Access Agent Portal turned on between October 20th and November 1st if you plan on selling in Georgia at all. And just generally, too, wanted to mention as well, even if you're going to be using Health Sherpa or another web broker platform, all agents are required to have the Georgia Access Agent Portal profile in order to enroll customers. So again, make sure that you're finishing the certification training by September 18th, and then between October 20th and November 1st, make sure to turn on your Georgia Access Agent Portal account. Make sure to activate that. And just have some resources for this as well. First guide there is just a PDF guide they gave for registration to the Georgia State-Based Exchange platform. Got some useful screenshots to walk you through that process. Below that, we have a link to the Georgia Access website. They said they will be updating this regularly as new information is released. And that's where they said as well on September 1st or early September, they will be releasing all of the certified web broker platforms. So be sure to check back for there as more information as well. And we also have there a link for where you can begin the state-based exchange certification process. Probably have to create an account, but that's where you can get started. And then the last one there too is just the text of the email communication that was sent out by the Georgia Access team. So if you missed that email, you're not sure where to find it, or if maybe you're still working to get licensed in Georgia, but you want to be ready by open enrollment, all of the links and the information is contained in there. So be sure to go ahead and check that out, especially if you did not get the email yourself. And we discussed this last month, but again, we've gotten a lot of questions about it. So I wanted to recap what we had talked about with the new CMS consent rules. So if you weren't already aware, effective June 18th, 2023, CMS released new consent rules that add additional requirements related to gathering and documenting consent for ACA agents. Some of the main changes we'll list out here. So they have clarified consent must be gathered prior to accessing or updating marketplace information, and that does include searching the marketplace. So it's really important that you're getting the consent at the beginning of the process. But then aside from that, there's a quote here. It's CMS does not prescribe the manner that agents and brokers have to document consent. So even though we probably recommend that you look at having a consent form that clients can sign either physically or electronically, CMS is not currently prescribing the manners that you have to document consent. So there are different formats that may be acceptable. That includes recorded phone call, text message, email, electronic document with digital signatures, or a physical document with wet signature. So you still have a little leeway. Just got to make sure that when you're gathering the consent, it has all the pieces of information that CMS requires, which we have listed right here. So these first three were already existing rules. All agents should have been gathering these, and that's going to be the date that consent is given, the name of the consumer or their authorized representative, and the name of the agent, broker, or the agency that's being granted consent. Again, all three of those were existing rules, so should have already been getting those. The last two are the big new additions that you need to be aware of. And that's going to be a description of the scope, purpose, and duration of the consent obtained by the individual, as well as a process through which the consumer or their authorized representative can rescind consent. So again, they're not mandating how you have to get the consent right now, but you do have to make sure that all of those are included. So make sure that you're getting familiar with those. Then the other really big piece of information that is super important is that consent records must be maintained for a minimum of 10 years. That is a really long piece of time because not only do you have to get the consent from the client before you do anything with them, but you have to make sure that, 8 to 10 years down the road, you can still get that consent form or that consent documentation and show it to CMS. So if CMS comes and they need that in 5, 8, 10 years even down the road, you need to be able to give that to them when they ask. So generally, what do we want to do? Well, first of all, we will say the new requirements are not retroactive, so you don't have to go back and gather documentation for applications that were completed before June 18th, 2023. These practices will just need to be implemented moving forward. So anything June 18th and afterwards, got to make sure that you're doing the updated CMS consent rules. But if you had anything from before then, don't worry, you don't have to go back and retroactively fix everything there. First and foremost, though, our biggest recommendation just off the bat would be to make sure you're recording and saving all of your calls with clients. If you're not already doing that, we would very highly recommend that you go ahead and start doing that. It's one of the best things you can do just to protect yourself and to have a record of all your contact with clients. So if you're not already doing that, make sure you have a call recording system in place so that all of your calls with clients are being recorded and that you're saving those recordings for future use. And then as well, make sure that you're gathering and recording the consent with each client before you access their marketplace data. And that does include marketplace searches. So even if you're just going to search someone up on Health Sherpa, got to make sure that you already have active consent from them. Just generally, we would say agents need to start making reasonable progress towards these new rules so that you're prepared for open enrollment. You're not expected to change your entire consent process overnight. That being said, though, agents really do need to start thinking about how they're going to gather the consent, how they're going to meet all the requirements, and then especially too, how you're going to maintain those records for 10 years. So if you have not already, definitely start thinking about that. Generally, the best thing to do first is to familiarize yourself with the new CMS rules, read through the model forms that we have linked in the next slide, read through the fact sheets, and just make sure you really understand what they're asking for and be very proactive when you're implementing these changes. Definitely don't wait until the last minute to think about this. So we would say as soon as you can, start creating your new consent forms or your new scripts. Make sure you're using them during enrollments, and then definitely organize your consent documentation to make sure that you're going to be able to maintain those records for long periods of time. Because again, you're going to have those available for up to 10 years. So that's going to be an important change as well. And then last, as always, we would say just look out for updates from CMS. This really is still a developing issue, and they are still releasing more clarification and guidance. So make sure that you're getting those emails from CMS. When anything is released, we will definitely relay any important information to agents as soon as it's released, but it's definitely good for you to try to keep up on it at your end as well. And these are some of the resources that I mentioned just a second ago. First thing up there is going to be the CMS fact sheet. That's just a high-level overview of the consent changes and the new rules. That's good. It's not as long and in-depth as the official rules, but it does give you a good overview of everything. There's also Health Sherpa's summary of the new CMS guidance and consent rules that's more narrowly focused to agents and especially the Health Sherpa. But then below that, we have the CMS Agent Broker Consent Information Collection. And that contains some model consent forms that could be used by agents when they create their own forms. And then the last link there in that bundle is just one better. It's just a link directly to that model consent form. So I'd highly recommend, if nothing else, look at that model consent form, read through it, read the instructions, and kind of start to digest them and maybe base some of your own practices off that, because that was released by CMS as a model form for consent. Also wanted to mention as well, as of July 1st, South Dakota has expanded its Medicaid program. It's now the 39th state to do so. That means that Medicaid is now available to South Dakota residents age 19 to 64 if their income is under 138% of the federal poverty level. So for a single person household, that's going to be $20,000, 120. So this does mean that the minimum income requirement for ACA in South Dakota has been increased to 138% of the FPL instead of 100%. So that's where it really will affect ACA agents. If you have any clients in South Dakota that are towards the bottom of the income level, just know that this is now in place, and so the minimum there is 138% of the federal poverty limit. And if you don't already have it, you can download a copy of our 2023 ACA cheat sheet from that link right here at the bottom. That's just got a chart on there so you can view ACA income levels by household size. You can see the ranges for each, the minimum levels for each state. You can see what the levels are for CSR. It also has a map that shows you which states have expanded Medicaid, and then other nice information like what's included in a household, what's included as income, etc. So if you don't already have a copy, definitely would recommend that you download it, at least just for that. The last thing that I wanted to cover as far as industry news this month is a new proposed short-term rule. So HHS recently published some proposed rules that affect short-term and individual market fixed indemnity accepted benefit plans. The second one's a mouthful, but typically that's going to mean hospital indemnity and plans like that. So this proposed rule reduces the maximum length of short-term policies to an initial contract period of 3 months, and then it just limits the allowance for renewals to just an additional 1 month. So that would mean that short-term policies would have a 4-month maximum. And that really is a huge change because the current rule is 12 months for the initial contract period, but they can renew it for up to 36 months. So if you think about it like that, the maximum would be hugely reduced. It would be going from a maximum of 36 months all the way down to just a maximum of 4 months if this rule is passed. It would also prohibit the same short-term carrier from issuing more than one short-term policy, again with a 4-month maximum coverage range, to the same consumer within a 365-day period. Probably also know this as stacking. And that's really important too, because that means that you couldn't just have one client on 3 back-to-back-to-back 4-month-long short-term plans during the year. After that 4-month plan is done, not only are they going to have to find a new plan, they're going to have to find a new carrier, and they won't be able to get another short-term plan from that same carrier for 365 days. So it is a really big change that would affect short-term policies and agents selling those. And then the other part of this rule that affects benefits for hospital indemnity or other fixed indemnity accepted benefit coverage on the individual market. The rule proposed that there would be a mandate so that those coverages would be paid on a per period basis as opposed to per service. That was the other big part of it. Might not affect people as much, but those are the two big things with this proposed rule. So most importantly, though, I definitely want to mention that this rule is not currently in effect. Right now, it is only a proposal. They are currently in a 60-day contract. A 60-day comment period that's open from July 12th until September 11th. If they do release this and they do accept it and it is released to everybody, final rule would most likely become effective in early 2024. After the comment period, they'll have to deliberate, and then they'll release the final rule, and then it would go into effect a little bit after that. So either way, wouldn't be happening until early 2024, but especially if you're selling short-term or hospital indemnity plans, it's something that you'll probably want to keep an eye on and look for as the rules get updated. The other thing about that is existing short-term products can continue to be sold until the final ruling becomes effective. So, it's not going to impact anything right now, just after the effective date. And then the last thing is that short-term plans that are in force before the effective date of the final rule will continue until their coverage terminates, even if the plan has a duration up to 36 months. So if the plan is in force before the effective date of the final rule, it will be able to continue until it ends. Again, just want to make sure that you're keeping an eye on this, especially if you have clients on short-term plans. And just some resources for you. The first one there, again, is just another CMS fact sheet that gives more of a high-level overview of the proposed rule, goes through all the changes that they're proposing. And then second there is the full text of the proposed rule. But I wanted to point that out too, because that is where you can add formal comments. So if you click on that, you'll be able to leave a formal comment that CMS or HHS would be considering. And I would say, especially if you have clients that are on short term, or if this is something that you think is going to affect you, go ahead and go in there and make a comment. Let them know what you think about it, if this is going to positively or negatively impact you or any of your clients. That's definitely the stuff that I think they want to hear. So if you feel strongly either way about this, go into that link there, leave a comment before September the 11th, and hopefully that can impact the decisions that they make. And I'm going to move on here to some O'Neill marketing news, stuff that our team wants you to know about. We'll start with just some contracting updates on the carrier side. First, we wanted to mention that Friday is not accepting any new enrollments in any state. So contracting for all Friday appointments is on hold. Wanted to mention this again because in the past we had said that they were still doing transfer requests. That has now been put on hold as well. So currently, all Friday contracts are on hold. We will let you know if this changes in the future, but just want to let everybody know right now. And then the other big thing wanted to mention is the Molina contract blackout period. It's been going since June 16th, and it's going to go until August the 14th. So during the period, again, for the next 2-3 weeks, you can still submit requests, but they're not going to be processed until after August 14th. So if you did submit any or you're planning on doing so, make sure that you check back then if you do request it during the blackout period. We'll, of course, be notifying agents once that's open, but just be sure that it's on your plate and that you're checking back. And when they are open, be sure to promptly complete any of the Molina contracting so that your appointment is completed and confirmed by open enrollment. Just because since they're not going to be opening until mid-August, there is going to be a smaller window to get that in before open enrollment. So just make sure that it's in your mind and that once that comes through, you do complete it and that you're all set up before open enrollment. And just some general contracting updates. We just wanted to reiterate to everybody again that now truly is the time to make sure that you have all your necessary appointments for open enrollment. I know it is still just the end of September, but it is really important that you go ahead and get started on it now. Open enrollment will sneak up on you, so it's important that you're appointed with all your carriers beforehand. Just generally, too, we are going to be moving away from using O'Neill Marketing NPNs for overrides. So that just makes it even more crucial that you have any appointments that you plan to write under and that you go ahead and get those appointments as soon as possible. So generally, I would just say if there are any carriers you are writing or plan to write, you should go check to make sure you have that appointment. And if not, get that appointment so that you can write all of those policies under your own NPN. That's especially important too for transfers because we have been seeing transfer requests take anywhere from 4 to 6 weeks on average. Again, it does depend on the carrier, but it is taking a bit longer than usual. So it's really crucial to put those transfer in early to make sure that you're properly set up by open enrollment. Just because carriers will typically start imposing transfer blackout periods as early as September. So aim to have all those appointments transferred by the end of August. Again, it does vary on a carrier to carrier basis, but some will start doing blackouts as early as September. So don't want to catch you unaware. Definitely go ahead and start thinking about that now. I would definitely recommend to just generally go check your O'Neill Marketing Agent portal, look at your appointments, maybe look at the policies you've been writing. And if you see that you are not appointed with any of the carriers you've been writing, or you're not able to use an uplines NPN, just make sure that you're getting that appointment yourself. Also wanted to mention that we have some contracting videos available, and these are just videos with instructions for completing contracting for some of the top carriers. We've added those videos to the agent portal, so you can go to the agent portal, go to the agent resources tab, go to the public folder, and then go into the contracting videos. And these videos just demonstrates the step that you'll need to take when you are completing carrier contracting yourself. So just a walkthrough of what you'll be looking at, how you can fill everything in, just to make the process a little bit smoother and more frictionless for you. Take some of the headache off your plate if you have to do your own contracting. And just wanted to mention as well that we will be releasing videos for additional carriers in the future. So whenever you're doing some contracting, I would definitely recommend you go ahead and check those contracting videos, see if we have any videos covering the carriers that you're doing. Our contracting team is always there to help, but I think these videos give a nice visual demonstration of what you'll be seeing and will probably help to move through the process a little bit easier. Another big thing that we wanted to mention this month is going to be about Ancillary and ACA add-on plans. We think these are really important products to be offering to your clients, especially the ACA add-ons. So we wanted to mention it because this is really something that we think everyone should put into their sales presentations to clients. Not only they're going to help to better protect your clients, but it's also going to earn you a little bit extra commissions as well. So generally, our thoughts on it are if anyone can afford a hospital indemnity plan to take some of the burden off of them when they're hospitalized, definitely would recommend that. If they can afford it, they should 100% do that. And in addition to that, if a client is over 40, they should probably be looking at some accident plans. or I'm sorry, if they're under 40, they should be looking at some accident plans. If they are over 40, probably going to want to look at some critical illness plans as well, just so, again, if worse comes to worse, they have some of that first dollar protection. And this is really extra important for ACA agents because about two-thirds of bankruptcies actually in the USA, 66.5%, are tied in some way to medical expenses. And the really crazy thing about that, too, is that about 75% of consumers who are having issues paying medical bills already have health insurance policies. So it's not really an issue of people foregoing coverage and not having any health insurance and then they get hit with a medical bill. It's actually people who already have health insurance coverage that just doesn't give them comprehensive enough. And then they get stuck with these bills that they just can't pay off. And these are the consumers that would hugely benefit from maybe an ACA add-on plan. So again, if they're under 40, maybe they want to look at an accident plan to cover them if they get like in a car accident. Over 40, probably want to look at a critical illness plan. Generally, what we think you should do is, when you're selling ACA plans to clients, especially something that's at like maybe the bronze or silver level, ask them if they have a deductible that's, $7,000, $8,000. If push comes to shove, could you pay this deductible? And as I'm sure a lot of you already know, most Americans don't really have enough money in savings to even pay a $1,000 expense if it came their way by surprise. So you can imagine too, anyone with a, $8,000 deductible or a $9,000 out of pocket max is probably going to have a hard time paying all that if say they get an accident or get a terrible illness. Nobody wants to think about it, but it is one of those things that when it happens, if they have this extra coverage, they will be very, very glad they did. So just say start working that into your conversations with clients. Ask them if they have a deductible or an out-of-pocket max that's more than maybe $1,000 or a few $1,000s. It's good to ask them, hey, if something terrible happened, would you be able to pay this deductible or pay this out-of-pocket maximum? And if the answer is no, probably the next question should be, would you be willing to pay a little bit extra each month so that you could have some of this first dollar coverage if, an accident or an illness comes across? Just something that we think you should really start working into your sales talks with clients and something that you should really be letting them know about. Because again, extra commissions for you, better protection for your clients, and they will be very, very happy they have it if it ever comes into use. And then the last thing we'll mention on this is that O'Neill Marketing does offer contracts with Ancillary and ACA add-on carriers. So, the big ones we have right now are going to be United Health One. We also have Shorebridge, which is changed names to Chesapeake. Then also National General, Allstate is another name for them. And then we're really excited too because we're going to bring in Aflac as well for some of the Ancillary and ACA add-on policies. We think they have excellent policies for your clients. We're going to be able to start contracting with them in the not too distant future. So keep an eye out for some emails and some updates about that Aflac contract. And once we have that in place, would highly recommend everybody go ahead and get contracted with one or all of these ACA add-on carriers and start marketing those to clients and start working them into your sales talks. Wanted to mention as well that we're going to have some upcoming open enrollment carrier webinars. So we're going to be hosting some of these carrier webinars prior to open enrollment, where we're going to cover things like new products, state lists, and then competitive advantages of working with each of these carriers. We wanted to do these webinars just to allow agents to hear some of these updates directly from the carriers because we think that's a good source and they'll be able to talk about everything that they're offering. So we don't have dates for these webinars right now, probably going to be sometime in the fall, but just keep an eye out. We will be notifying agents when this information is available. So just check to make sure that you're receiving the emails from O'Neill Marketing, and then you can check our website, the webinar page of our website, for any updates. Once those are set, you will be able to register for those, and we're very excited for those coming up. Wanted to also give everybody an update on the Callidus commission system. So as of a few weeks ago, all of our commissions are now being processed solely in Callidus. We think this is going to be a huge benefit to agents, and it's going to let commissions run a lot faster and more automated as well. Only thing right now is that commission statements for those Callidus runs are not yet available through the agent portal. Our team is working hard to have those available for agents shortly, so we will let everybody know once you're able to pull statements, and then everything, once that's done, should work the same. We should be able to get everything you need right from the agent portal, so just keep an eye out for that. Once everything is set up too, We will be hosting some training webinars and giving some information about the changes that are going to happen with this Callidus system, any other changes that are going to be coming along with it. So just keep an eye out for those informational emails and then any announcements regarding Callidus or the new commission system. We think y'all are really going to love it. Once everything is set up, we think it's going to be a huge benefit to everybody. And then the last thing I wanted to go over with you guys this month are just some of the updates we've made to the agent portal. Some of these have been coming in over the last month, but we just wanted to wrap them all up into one place and let you know about all the changes you'll be seeing. So first, we have made some changes to the navigation bar. So we moved just the most important tabs up to the top. So you'll see your appointments, commissions, carrier resources closer to the top, just a little rearranging of that. Another big thing is the Files tab has been renamed to Agent Resources. Still got a lot of the same stuff. Agent Resources, just frankly a more accurate name for what's contained in there. Videos and webinars as well have been moved to the Agent Resources tab. So everything that used to be under the Videos and Webinars tab is now going to be under there. Again, just click into the Agent Resources, go to the public folder, and you'll see the videos and webinars are now in their own separate folder. And then we also added a link to our FAQs under the Agent Resources menu. So you can click on that drop down and then you'll get to our FAQ page. That's really nice. We've got a lot of FAQs related to the agent portal. So if you're ever having any issues, definitely recommend you go and check out that FAQ page and see if it's something that maybe we have an easy solution for you right there. We have also added broker support and commission emails to the carrier resources tab. So any broker support emails or any broker commission emails that we have for them are going to be right there. So if you need to get in contact with carriers, you can check there and see if we have an email on file. We've also added Training Central registrations and logins to the home page of the portal. Training Central, that's our platform where we have trainings on Health Sherpa, on using the agent portal, on new ACA agent trainings. So if you're not already registered, we definitely recommend you go ahead and do that, and then you can log in right from the homepage of your agent portal. And then we also added a link to our webinar page so you can easily find recordings of webinars and register for upcoming webinars. Again, that's just a link that is now right on the homepage for you. And then the last changes to the agent portal that I wanted to mention to everybody. So commission statements are a little different now for admin accounts. So now admins can get commission statements for their downline agents and agencies all from their one admin account. So where you used to have to go and hop into different accounts to pull those commission statements, now you should be able to select the agencies and then any downline agents right from that commission tab, and then you can pull everything onto one consolidated commission report. Again, as I mentioned a few slides ago, the Callidus commission statements are not yet up on the portal, but once that's all set, it'll still be the same and you'll be able to pull consolidated reports for your entire downline. And then we've also made a few changes to the agency management tab. We covered them all in last month's webinar. So if you want to see a demonstration of this, go ahead and check out the June ACA Roundup webinar. The big changes that we made, though, are we have drastically increased the loading speed. So you'll see your downlines and the agents are loading a lot faster now. We also made some changes to the agency dashboard so that you can see all of your downline agents and agencies just again on the one main dashboard. Don't have to click into multiple pages. And then we've also added those appointment exports for your entire downline. So you can get, again, one consolidated report that'll show you for all your downline agents which carriers they have completed and confirmed appointments with. So that'll be very useful as well. But just in general, too, we are always updating the agent portal. So there will be more updates to come. Keep an eye on that, and we'll be releasing stuff as we make those updates. But in the meantime, though, just please let us know if you do experience any issues with the agent portal. Your feedback is very, very valuable to us. That's what makes it so easy for us to update and make the portal better. So if you do encounter any issues, please shoot us an email to support@oniomarketing.net if you need any help with your agent portal account. And the last thing I wanted to mention is just the date for our next ACA Roundup webinar. So the next Roundup webinar is scheduled for Tuesday, August 29th, again at 2 p.m. Eastern Standard Time. So go ahead and mark your calendars, get ready for that. There's a link right here in this slide that you'll get where you can go ahead and register for the Roundup webinar right now if you'd like. We'll also be sending out emails in the future as well, so you can register then. Just make sure you go ahead and put it in your calendar, and we're looking forward to doing this again next month. And that is going to bring us to the end of our July ACA Roundup webinar. Just want to thank everybody again for coming out and joining us. It's been really a pleasure to be able to do these for you all every month and to let you guys know about all the important updates. As always, if you need anything at all, the O'Neill Marketing Support Team is here to help you. We've got our agent support hotline phone number on the screen, as well as our agent support email address. So please, if you have questions or need anything at all, feel free to reach out and we are here to help you. So thank you very much, and I hope that everybody has a fantastic rest of their afternoon, and we'll see you again next month.